What's on my mind? Well, today's election day, and probably the most important thing that's on my mind is the importance of all of us getting out there to vote. Now, by the time this is posted, I know that election day will have passed, and I hope that many members of the Weill Cornell family have went out and voted. This is critical to us as a functioning democratic society. What we've seen over the course of the last several years is a decline in voter participation. That's not good. When we think about things like science being under attack, part of that is the way that we vote. And so all I want to say is get out there and vote. Other thing that's on my mind, it's the fall. We're about halfway through the fall semester. And it's been a great first semester getting to meet the medical students, getting to meet the PA students, the graduate students. We have a remarkable educational community, and the leaders in the grad school and the med school do a phenomenal job of continuing to attract and accept just absolutely outstanding students. So voting's on my mind, and our students are on our mind because it's fall. Children's health is probably one of the most important areas of healthcare that we as a society need to focus on. If you want to talk about prevention being worth many pounds of cure, there's no area that's more obvious than children's health. If we can take care of children and young adults, that's going to pay dividends to us as a society for decades to come. Critically important. Unfortunately, as a society, we've not prioritized children's health. What do I mean by that? Many of our children, the majority of our children who have chronic diseases, are taken care of on the Medicaid programs. Those programs pay substantially less for those children's health care than, say, Medicare does for our seniors. Then private insurance pays for working adults and families. That's just wrong. We need to be able to elevate the quality of children's health care through increased Medicaid payments. We need to figure out a way to make it so that the emphasis is on healthy living for our children going forward. As I said, prevention is worth a lot more than trying to cure things that evolved many years or decades later. Children's health, key priority for Weill Cornell Medicine. In academic medicine, one of the key features of my own leadership is what I call relationship leadership. And that means really getting to know the people that you work with, because a good leader surrounds him or herself with people who bring expertise that they don't have. And when I think about that, that means that you need to understand the people who are around you, what they're good at, what skill sets they bring to the table. And it really allows you to build out a team that is the sum is more than just the collective parts. And that to me is really important. I also talk about relationship leadership as getting to know people in an authentic way. In some of my former leadership roles, I would formally schedule what was called wandering time. I would wander around the building and just pop into people's offices and ask them what was going on. When I was out west, I took advantage of the weather and would walk around campus and get to see people. I have to admit that here in New York City, I've not done as much wandering as I might, but perhaps that's something that in 2026 I can add to my regular portfolio of meetings, really getting to learn better about the people I'm working with, the people that I'm leading. One of the most important things I want to accomplish here at Weill Cornell is to get all of our clinicians thinking more about clinical research. To me, there's been this artificiality in the separation of clinical research from clinical practice. I understand historically why it evolved that way, but I think we're at a time in history, if you will, that we can bring back together clinical research and clinical practice. My basic response when people ask me, why is this important, is I say, well, there are really only two ways a clinician should answer a question. Number one, the answer is known, and we ought to just figure out a way to do it. Number two, which is most times in clinical medicine, the answer is not known and we ought to study it. And that to me includes randomization. Now, there are some places that are doing this quite well, just even looking at very, what I'll call pedestrian questions like, what's the best form of IV solution to use amongst our critically ill patients in the hospital? Seems to be a simple question, a lot of equipoise. Why not just bring that into the research domain and integrate that into our clinical practice and randomize patients to one type of IV fluid or another? There's also a great comment that was made by our recent new chair of neurosurgery, Jay Marco, who made the comment one of the reasons he likes clinical research so much is that as an individual surgeon taking care of an individual patient, he can help that patient, and that's critically important to him in his practice. But when he does research, he can actually extend his reach to hundreds, if not thousands of patients. I love that answer, and that's absolutely something we want to work on here at Weill Cornell. I think clinicians should be active on social media because we are learned intermediaries. We should be combating the forces of misinformation and disinformation, not in a way that's negative, not in a way that's confrontational, but just as the old Joe Friday saying goes, just the facts. And let's be able to convey that to our patients in a way that's not condescending, in a way that's not judgmental, but in a way that moves their, and by extension, the population's healthcare forward.